A lot of people ask me one thing about stroke rehabilitation, and here's what they ask. They ask about the basic fundamentals of what's most important when you're rehabilitating a patient with stroke and what is the number one thing that matters. There's a lot of things that happen in stroke rehabilitation that won't lead to one single answer, but there is a key thing that matters for a lot of people as they learn to go through the process. Early on in the process, some strokes are so severe that people cannot really get out of bed. And there's other variations of it where they can easily get out of bed and they can do things that are much simpler. Then their disabilities can range from simple facial abnormalities all the way through to paralysis, and could also range from disability and lack of mobility and strength in an entire side of their body. So the key thing here is, what could I share with those individuals? Hi, my name is Dr. Vinod Somareddy. I'm a physical therapist, and welcome to my channel. So the one thing I want to share with people about what is very important to stroke rehabilitation is the functionality of the core. I know we think about the core in terms of exercises for athletes a lot of times, and for different professionals that use their core every single day, like dancers and swimmers, etc. But in stroke rehabilitation, the core is such an important part of getting you off and moving. A lot of times, if one side of the body is limited, by utilizing core strength and improving core strength, you can really get to a point where you have actually a lot of success in your extremities, your arms, your legs, and your neck to stabilize yourself as you move forward into more of a functional activity. One of the things I share with therapists all the time is, if you can start to work a little bit on the core along with everything else, then you can start to establish the real key pieces of the core of the body and engaging those in conjunction with your extremities. So as you get your patient into a situation where you want to introduce motion, like just getting them to bend or move their body, it's really important to think about what you want to do to get that motion going. Do you want to use a weight? Do you want to use a ball? Do you not want to use anything to start facilitating some resistance through the motion, right? So a lot of times, just simply getting somebody into a situation where they could move to one side or engage their core is as easy as just having them sit up and down if they can do it. A lot of times they can't even perform those activities. So what do? How do you figure out what is the best way to get a patient into engaging their core in a safe manner that requires them to be very, very engaged, but also like sort of trick them into doing it because they can't think with doing it at the moment. So one of the things I think about all the time with the core is, can we do it in the seated position, and can we add some resistance so they could shift their weight to one side and engage their core? So there's a very simple exercise that anybody can do at home, and you can use a ball, you can use a dumbbell, you can use any kind of weight you want. And you have to think about weights, right? A resistance kind of activity doesn't always require like a professional dumbbell. However, if you really think about weights, theraballs, and different little weight resistance functions that you can get from different things, it's very easy to know that you can order that stuff on Amazon and just get a weighted ball at home for 20 bucks. So that's a really cool thing to have around the house if this situation did come. So why don't we go into it? Why don't I show you a simple exercise to do to start getting you to shift your weight in a patient that has a stroke. In a situation like this, if you do have a ball that's around, like a ball like this is a simple ball you can buy on Amazon or at your local store. And as you kind of come into the situation with, as a therapist, one of the most important things is always safety, right? So this bench isn't particularly the most safest bench for a stroke patient. However, it's here for demonstration purposes, right? So if you have a ball and you have a patient sitting, I'll just be the patient. And usually if the stroke is on the right side, you'll have deficits on the left side. So if you have somebody sitting here beside you, you could use that. And a simple exercise here is just having them hold the ball in the position and lean over to the left side. Now, they may initially fall over. That's like very possible. But as you kind of get them to lean over to the side, they'll shift their weight over and they're engaging their core. And you want them to engage this side of the body's core. You can start off with having the ball just in a comfortable place for the patient and have them shift weight over. And you want to make sure you support them. And you can just keep the ball there and have them rotate, shift weight, They can even move their arms over a little bit if they're strong in their arms. Now, of course, their left arm is not going to be able to do this in most of these cases, so they may just have to hold the ball like this and shift over. So that's a common situation where this arm, because of the affected side, isn't able to support their strength. So they came and do this, right? So you want to have somebody safe here to help support them. But even if they had to sit and hold the ball to their body, with just, even if they couldn't get this arm there, but they had to hold it with their right arm there, you can slowly start to work them over. You can slowly start to have them turn over, and they're reluctant, and you're gonna force them to put weight through their feet. Like they'll likely have to use this leg to support their weight as they go over. So those are some simple things you can do. The patient may have a reflex and they may want to just fall over. But again, the idea is to engage the core and have the body working together. Now, because this is a neurological injury from the brain, a stroke is not as easy as it sounds to engage the core. And the recovery and the improvements may be slow, but over time, as a person understands it, their sitting balance starts to improve. So there's different things that can be done there. If you did want to like actually have a ball and kind of tuck it to the side here and help them, if you're here and you want to support them, and even if they hold the ball here, they could change the angle of the ball to be more on one side. It could be even over here if you wanted to. So there's opportunities there to give a different challenge, so you engage different parts of the muscle as you go through the exercise. You want to make sure you're very safe with the exercise. That's a huge part of it. And there's a lot of things you can do with the ball, even when you're seated here. You could have the ball between the legs and hold the ball there to help the core engage and just keeping them stable and supporting them here if they need the support. As people progress, and depending on the degree of stroke, as it could be minor or major, they'll have better seated balance, and they'll be able to be better able to support their core. So it depends on the patient, it depends on the severity of the stroke. But again, a lot of these exercises are able to support the patient. Even having the patient holding the ball with this hand and balancing it this way on their good side, right? If the left side is the affected side, that's still not a bad thing. Even if you place the ball here on their leg and they have to kind of balance it here, right? Like this arm is not going to work. Let's say the arm is here and they're holding it here and they're kind of just trying to get the feeling of that ball and that weight on that side. It's still going to engage their core. So you want to keep that all in mind. And it doesn't have to be drastic. It can be as simple as just keeping it there for like 5 seconds, removing it in the beginning, keeping it there for 7 seconds and removing it and building it up. It takes time. But we don't want to forget about the core. I always tell therapists that in their training is that, sometimes as we look at what we're doing with the legs and the arms, we want to try to focus on those pieces because they're the most functional things that help them push up, that help them get going. But even the simple things, by just having them do this on their own or with their caregiver at home, it makes a world of a difference to start off with, So I recommend a simple exercise that would help with the seated balance and engaging the core with a weighted front, shifting over, shifting to the side, and getting them to even look. If they have the ball and they have it here and they're just turning their head and looking over, that'll get them to engage over as well. Like just imagine if you take your eyes and look straight and you turn your eyeballs over to the left, you'll feel yourself shift over. And even just that, you have the ball sitting here and you don't do anything and you have them turn their eyes over. If the left side's affected and their eyes turn over, they're gonna lean a little bit this way. So that might be the first thing you do to start off, is just get them to look that way. And then just look that way, turn that way. And then it could be turning your head to the side and looking a little bit further back. All these little cues will engage the core, and you may not even use the ball. Now, as a person advances, they might do more. They might have to use the ball and turn a little further. They might have to rotate a bit more. It may take some time to get used to it, and you may even have to take a step back, because some days may be better than other days, or worse than other days. So that's okay. We can do that. So that's a fun part of rehabilitation for a provider to help out, and it's also the challenge for the patient to learn and adapt over time. And that's always a great process, and that process just is what rehabilitation is all about. So it's a good reminder that stroke rehabilitation requires the core, and we shouldn't forget about how its engagement can help facilitate the course of the rehab. Let's get a quick recap of what these exercises look like. So first off, you want to use a seated weighted ball or a dumbbell to kind of initiate just getting some weight onto the left side. And then after that, as the patient progresses, you want to have the patient try to use their head or turn their body to the left side if the affected side is the left side, to engage more of the core and more of the seated balance as they go into that motion. Thanks for watching. This is Dr. Vinod Somareddy. This is Reddy Care Physical Therapy, and I'll see you soon.